Hi, this is Pam Dunwood with Your Nurse Advocate Consulting. Today, we wanted to create a video regarding adult children of aging parents helping their parents manage their medications. This is just one of the many topics that we have as far as helping our aging parents live a healthy life and help them on their healthcare journey. So, we're going to talk about five um, must know tips when it comes to managing their medication. So we're going to go ahead and get started on those. So the first one is this is kind of heads up the whole thing, but we want to be able to talk to our parents about their medication history. Can they tell you what medicines they take? Can they tell you what they're for? How to take them? Do they take them in the morning? Do they take them in the afternoon? Do they take them with food, without food? First thing in the morning before you take any other medication? Or is this something taken at bedtime? Kind of just ask them, Ma or Dad, tell me about your medications and how you take them. And see, what what they're able to share verbally with you to kind of give you an understanding about what they know about their medications and how they're taking them. So that would be the first step, just kind of that history of what they're taking and how they're using them. The second thing is the list. And I the list is really, really important. Sometimes you get a list from the doctor, and that's an easy one to use as long as you make sure that that is a comprehensive list, because nowadays a lot of, they have your primary care provider, you have Dr. So-and-so over here, Dr. So-and-so over there. And sometimes they're prescribing different medicines. And hopefully the systems talk, but they don't always, from clinic to clinic or hospital to hospital. So you want to make sure that the list is comprehensive and that it is accurate. It's so important when medication changes occur. So if they go to the doctor and they're put on a new medication, we have to make sure the list is updated. And the same goes for when medications are discontinued. There's nothing, more hazardous than to have a doctor or provider discontinue a medication. They don't get removed from the pill boxes, or those pills don't get taken away, and they continue to take them because they don't remember to remove them, and they're just in a system and a routine, and they continue to take a medication that they've been discontinued. And we might get into trouble because maybe that medicine wasn't working as well as it should. Say a blood pressure medicine, now they're given a new one, and if they're continuing to take the old one and the new one, that could have serious impact on, lowering their blood pressures too low or other side effects. So you want to make sure that you're getting rid of any medications that are discontinued. Some pharmacies will have drop boxes where you can bring in old prescription medicines and actually dispose of them. And that would be my suggestion, is to check with your clinic, or your parents' clinic, and say, hey, what's the closest place where I can dispose of prescription medication? Another thing about the list is make sure once that list is done and it's completed, we want to make sure that our parents either keep it in their wallet or keep it in their purse, so they have it with them wherever they go. I mean, God forbid that there's some kind of an emergency or accident and they're not able to share, their medications, that they will have this list with them. And on top of those lists of medications, we also want to have their allergies listed on that, because that, could be just important, as the list of medicines itself is for a healthcare provider to know what allergies that they have. Now, sometimes, medication can be a sensitivity issue, not a true allergy, but everyone, providers, they need to know that too, if it causes headaches or an upset stomach or nausea, vomiting. So that is something that, we would not want to have prescribed if we have a sensitivity to that medication. Okay, so number 3, the third thing is, what is the best system for your parents to be able to take their medications routinely, on time, and accurately? And so there's a lot of systems to do that. Obviously, the first one is that your parents are alert, and they can just routinely take the pills out of their bottles, at the prescribed days and time. And, that's oftentimes the easiest way. The next thing, if they need a little bit more help, you can go to a pill caddy, which is like a pill sorter. You can get them at any drugstores or, department stores, things like that. And where someone, you or a family member can actually, or a spouse can actually set up their medicines, by the week or by, and you could have one if they take multiple times during the day. Sometimes you can have a morning one, or some of the pill caddies actually will have enough spaces for morning, noon, evening, and then bedtime. So, you want to get the proper pill caddy based on how many times a day, your parent is taking their medications. If you're noticing that they're sporadically not taking their medications as directed by using that pill caddy, then, another step up would be what we call bubble packing. Bubble packing, most pharmacies can do them. There is like an extra charge, an average maybe $5 per card. And what they do is it's like a punch card, and they put the little pocket filled with medications for their doses, and they have a card for, each time of the day, like your morning card, your afternoon card. And they oftentimes have about 30 days of medication on a card. So once a month, these would need to get refilled. The only challenge with bubble packing medicines is that sometimes, depending on how frail your aging parent might be, they have a hard time punching out physically, being strong enough to punch those pills out of the card. So, they have trial cards. Don't hesitate to, go to the pharmacy and say, do you have a sample card that I could see if, my mom or my dad can actually utilize this and push the pills out? So that would be the one downside, is if they're actually physically having trouble getting the medications out of the punch card. Number 4, drug reactions. We want to be aware of some side effects of the medications that your parents are taking, especially if they're taking narcotic pain medication. Maybe they've just had surgery. A lot of people are suffering from chronic back pain or hip, or, a pain where they need to take something a little stronger than, say, Tylenol or ibuprofen. And right along with this is the as needed medication. So you wanted to know some of the side effects, because you may notice if they're maybe double dosing inadvertently, or they're taking more than they should, because sometimes we live in a society where more is better, and they just think, well, one won't, isn't gonna hurt me, I tolerate it, I'm still having pain, let's take another one. And so those are red flags that, there's some issues with their medication management, or their need to have some adjustments. So the as needed medications, keep a close eye on that, because those are medications that a physician or provider would prescribe, that they don't take routinely, but they just take periodically as needed, such as a pain pill, or maybe a pill for indigestion, or maybe a pill for loose stools or diarrhea. So just make sure and that your mom or dad knows when and how often they're supposed to take these as needed, or what we call PRN medication. So kind of know some drug related symptoms or side effects, so that you can help, notice if something is off, maybe with your mom and dad. Okay, the last thing is in being familiar with, the medications, certainly reach out and use your resources. There are a lot of resources out there. And one of the easiest things too is, every now and then, maybe you pick up your parents' pills from the pharmacy, which gives you an opportunity to directly ask the pharmacy questions about the new medications and what to watch for, or why they're taking it. And, to get the information straight from the pharmacist might be very beneficial. And then you can, you're number one, you're made aware of the medication and all the nuances. Plus, then you could explain it to your parents. Oftentimes, when our parents get old and they have these things explained to them, they're not remembering everything that they were told. They're remembering bits and pieces, but they don't remember the whole story. One of the last things I wanted to mention, and we did a complete blog post on this, and we've got this all in writing, so if that will be handy. In the details description of our video, we will have access to where you can get to the blog post, and we will have some free resources for you to get on. And if any of this is interesting to you and you'd like to stay in touch, and when we present more of these type of programs and and articles and videos, there's an opportunity to get on the newsletter list. For that, we're going to give you a nice checklist, 11 signs that your aging parent or spouse may need help on the home. So we give you that for just joining us on our email list. And, consider subscribing to our blog or subscribing to our YouTube channel. This way you'll be informed when there's new videos come out, and you have an opportunity to take a peek with the subjects that may be most pertinent to you. Last thing I'll mention is one of the delivery systems that I forgot to mention is if you're into technology and something a little bit more sophisticated, there are actually units out there. And the one that we're most familiar with is the Hero unit. And in the blog post, we do have a discount code that you can use for that, for the setup. But actually it dispenses the medication. It holds it in the machine. It dispenses it. It gives a reminder when they're supposed to take it. And then say you as the child, the adult child of the parent, you can download the app for the Hero unit on your phone. And if for some reason the medication is not dispensed and it's not taken at the time that it's supposed to, you will get an update, or you will get notified through the phone app that they missed their dose of medication. So that would be, the most sophisticated way. And depending on how many medications there, I mean, it's not horribly unreasonable. It can be about $25 to $35 a month, with what we've seen, again, depending on how many medications and how often things are being taken. But that would be kind of the creme de la creme, so to speak, of a medication dispensing system to, to help your parents be able to remember when to take their medicine, and also will notify you when they've missed a dose. So that's also a red flag too, that for you to be able to check on your parents and make sure everything is going well. So with that being said, I'm going to go ahead and we're going to call it a video, and we look forward to seeing you back here soon sometime. So thanks for stopping by and joining us. Take care.